And you are now live.
All right. This is Senate Appropriations, and we're switching today. And instead of doing budget adjustment, which I think the House is voting on today, or maybe has voted on, and to pass it, we are going to get an overview of the governor's proposed FY 2023 budget. And so we have Adam Gresham and Hardy Merrill here to give us that overview on behalf of finance and management. So welcome and a good day to spend a Friday afternoon. Do we have a meeting at 4?
There is an e-board meeting at 4, Madam Chair.
Yeah, that's what I.
It's going to be the shortest e-board meeting maybe in the history of e-board.
That's my goal. Okay. Then I don't know who's doing the presentation. I guess maybe you, Commissioner, or however you want to do it. Do you have slides that you want to share?
We do.
Okay.
Actually, you should have a document that you received earlier, 2 documents you received earlier this morning.
Yeah, we have the little budget book and we have the big bill language.
So the little budget book, on page 16 of the PDF or page 15 of the actual book, you'll see the general fund overview. Madam Chair, this should be a familiar page to you. We went through it briefly before, but that's what we will go through for those who have it on their screen. It's the page 16 of the PDF.
Well, I have the general fund budget overview on page 15 of the booklet.
Yes, and that's 16 of the PDF. Either one, it's the same page.
Okay.
And I have mine at 150% magnified, just because one of the challenges with the budget this year is there's so many things packed into it that it was hard to get on one page.
I know. Your folks who were very busy thinking of ways to spend all this money.
Yes.
Mm-hmm.
So I don't know. Having said that, I'll say I'm not sure which is the bigger document, the budget adjustment for FY22 or the big bill for FY23. They're both pretty beefy. But
wait until you see the pension bill.
Oh, I can't wait.
I thought so.
Anyway, I thought I would start from the top here, and Hardy and I are going to tag team. I thought I would take you through the top of it, which just shows you the revenue sources we're using and some of the revenue deducts that the governor is proposing. And then Hardy would launch into the uses of the revenue that we have and tag team from there. So anyway, thank you.
Committee, you can see, we'll connect our earlier conversation about the e-board. And if you look on that chart, you can see that we have to make a correction. There was just a Scrivener's error that has to be corrected, and it does change the numbers. So fortunately, it was discovered before the governor's budget was finalized, and the commissioner and his staff were very helpful in recognizing it. So what we're seeing presented to us is reflective of making that correction, which we will approve in our e-board meeting this afternoon. So I just wanted to connect back to my comment about the e-board meeting.
Adam, are we on page 16 of the little budget book?
Page
15.
15 of the little budget book. Only as a PDF, it shows up as 16. So,
okay.
And it's titled the FY 2023 General Fund Budget Overview. That's the heading you want to look at.
Okay.
And what I was referring to is the second line, and that's the technical correction, and that we're going to have to approve this afternoon.
What time did Chrissy email that to us? 11:46.
I think so.
It's on the committee webpage too, and it's what I'm looking for.
It is 11:46, Bobby.
Yeah,
Correct.
okay, good to go.
All right, everybody all set? Okay, Great. So we'll let you start. I'm sorry I jumped ahead, Adam, but I thought
No,
as a
that's all right.
courtesy to the committee, I would let them know why the e-board was having to meet this afternoon.
Well, thank you for spending some time in the afternoon with us. Adam Gresham, Commissioner of Finance and Management. And with me is our Budget Director, Hardy Merrill. And I thought I would do the top part and Hardy would jump in towards the middle and we would kind of tag team from there on. So just starting at the very top. So that is the emergency board revenue. As the chair has said, it's going to be corrected by 8.1 million. That is incorporated into our revenue estimates. Directly below that, you see some of our traditional sources of revenue for the general fund. There's the notwithstand language directing excess property tax, property transfer tax into the general fund. There's also a number of direct applications that shouldn't raise any eyebrows in terms of what appears on there. The total of our direct apps this year is $75 million, which actually is similar, maybe even a bit lighter than the prior year. There are a couple of those categories that are down slightly, although in the grand scheme of things, it doesn't make that much difference.
Sometimes DFR fluctuates.
Right.
Yeah.
And actually, this time, unclaimed property and Secretary of State are both lower than they were the prior year for various reasons. And, you know, Hardy and I also have reason to believe that these are very achievable numbers. You're probably aware that, you know, the Attorney General settlement virtually always comes in, or in the past few years anyways, come in above 2 million. Historically, 2 million has been a decent estimate, but there's been a fair amount of litigation, both locally and nationally, that has expanded that direct application, but we think 2 million is very achievable. You know, both liquor control and unclaimed property and Secretary of State are all a little bit lighter for various reasons. But you know, the point I was making is that I think that the numbers here are very achievable. So when we add that to the base, and then we add in what is going to be about $77 million of carry forward, we come to the total of 2.110 or 2,110 million of revenue that we have to deploy. I commented a few days ago to the chair that number 2 years ago when we sat here, right before COVID struck, so kind of the last normalcy that we had, that number was over $400 million lower. So really in the 2 years that we've been here, we've gained $400+ million of revenue, which is really, you know, it's just an extraordinary to think about that. But anyway, so that's where we start. And I don't think it would surprise anyone on the committee that with that amount of revenue, the governor was inclined to look for tax expenditures that he could use that would fit into some of his larger objectives. So below there, you see under governor's initiatives, revenue initiatives. And we start off actually with $2 million. And this is a hope that Senator Sears can bring his substantial legislating skills to bear and get sports betting across the finish line this year. That has been a frequent, you know,
I think we have to put that bill into the budget itself. It doesn't seem to be moving in the right direction, and it's been troubling to me. And frankly, actually, I was thinking about it this morning. Where is that bill? And it's still stuck in economic development while they do all these other things. And then the last I knew, it was still in the form of a study. So it's hard to get 2 million out of a study. In the meantime, you know, New York just came up. That DraftKings has already moved into New York. So, you know, we're just losing to every other state in the region.
Well,
I think that it was more receptive. Our Economic Development Committee, I think, was receptive. I think probably we may have a different position in the other body, but we'll see how that progresses. In the meantime, you're assuming revenues of 2 million and spending it.
And that is, I would go on to say, in past budgets, you may remember, we had, I think, $2.5 million estimate. The 2 million estimate is very conservative. And we anticipate that as it becomes more known and as we work out whatever kinks are in the beginning, that number will grow. But liquor and lottery thought that was a very conservative estimate.
I would agree it's conservative, but unless we can get a bill passed,
I agree.
It might be zero.
it might be zero. And I mean, it is frustrating. Frankly, it reminds me of other initiatives where you have the governor and the Senate behind something, and because it has to do with betting, I guess you can't move them. But like I said, we're seeing the ads from the Albany TV stations all the time about DraftKings now, and there's a special bet I can make tomorrow on the games this weekend. Give me great odds in there. They're free bets just to get me involved with DraftKings.
Right.
Well, we'll have more conversation on that. It seems like that's a way to go. You're optimistic that somehow it's going to happen. If
Right.
it doesn't, we'll take it from there.
I think we should
And-
put it in the Senate budget and let them take it out.
Well, normally we don't raise revenues in the budget bill. We ask finance to do it, but we'll have that conversation, I guess, internal to the Senate.
Yeah, I mean, it's just ridiculous.
So the 2 million that we're assuming from sports betting offsets 51.5 million of tax expenditures that you see below. And, I think, I know that you guys will have Senate Finance go through on this, and I'm sure Commissioner Bolio can give you many more details. But, these expenditures, again, are fit into various initiatives the governor has had. I'm sure no one will be surprised to see military pension income tax exemption back on the sheet. This has been, I think, every budget the governor submitted. But it's substantially below, you see changes to the earned income tax credit, the child and dependent care credit, as well as lifting the Social Security threshold. You'll recall that currently Social Security income for household incomes that are $45,000 or below, Social Security income is tax exempt. We are advocating for moving that threshold up to $75,000. So that, along with a EITC boost to 45% of the federal credit, which, by the way, would make Vermont tied with California for the most generous EITC state. Anyway, those three initiatives combined are about $21 million. We're also calling for removing a cap on student loan interest deduction for various reasons, but most importantly, because frankly, it is a burden for many students. And we're trying that fits into the idea that we should attract more students to stick around if they come to Vermont. There's also a tax credit for nurses that looks at the shortage we have, and a child care worker income tax credit that also acknowledges the shortage we have and the difficulty it is being a professional child care worker. And
So that's a deliberate policy decision to use the tax structure that way, when some people would argue the fundamental problem is the low wage. So, or it's a supply issue, like in the case of nurses. And that's one area we've been focusing on, and that is how to expand the supply of nurses, because obviously the shortage is being driven by the fact that we're not graduating a sufficient number. And so part of the challenge here is to get our nursing programs expanded, because they're capable students who just can't be admitted because there isn't sufficient capacity to take on more students or to find the placement. So we'll have to have more discussion around that. Obviously, the tax committees are going to be looking at those. But I will say that some of us on this committee have been very concerned about the shortage of nurses. We're very concerned about, what we see with the traveling nurses and what that's doing, but that's possible because there's such a shortage. And And so there has been a lot of emphasis to say, look at how many you're graduating and look at the need and the gap. And it's not unique to Vermont. So everybody's out there competing for an inadequate supply. So, I think we're going to continue to try to look at how do we expand programs so that we can begin to close that gap between nurses graduated and retirees and what that need is. Senator Westman?
I have two comments. One, the American Academy of Nurses said there were 80,000 students nationally that applied to go to nursing school and were qualified to get in the school, but there wasn't placement for them because the schools can't produce, can't do exactly what the chair is talking about. And also, I sit on the board at Copley Hospital, and one of the members of the board that sits next to me is the director of a nursing program in the university, the state university system in New York, I think at Potsdam, and she's losing people teaching to be traveling nurses because they can make $50,000 a year more as a traveling nurse, and she can barely hold her programs together. At some point, we have to make a concerted effort about getting people into teaching and helping with the teaching. And I hear all sorts of stuff about clinical stuff, but we have 3 nurses on staff at Copley that have done programs. They just don't want to travel to teach all over.
But that raises a question. Are you proposing that a nurse who's a contract nurse that is earning so much more would also get this tax credit?
Yep, they shouldn't.
I guess that would be part of.
I think
But
so. I
that's
mean,
wrong.
if they file Vermont income taxes, presumably.
But what we've got to
Okay.
do is curb letting traveling nurses operate. I mean, those nurses moving from one hospital to the other constantly can't be very efficient.
Well, that's a larger discussion, and the first cut will be by our tax folks. So, but it did raise the question, if you're a nurse and you're a traveler and you're earning so much more,
Yeah.
so
Let
who
'em
your
pay.
tax credits proposed to benefit? But we'll keep going. As you can see, we're not the tax, but obviously any of these tax expenditures impact the revenues to build the budget. And so these are ongoing. These are ongoing reductions to our revenue base, which 18 months and when we start unwinding, that base growth is pretty anemic based on what our economists are telling us. So I'm sure that'll all be part of the examination. And of course, there are other tax proposals being advanced by the committees, including Representative Ansell's child care refundable credit. So we don't need to spend a lot of time vetting them because I'm sure they'll be looked at very carefully by the Committee of Jurisdiction. So we'll keep going, Commissioner.
I would note that the nursing income tax credit also is tied in, or not tied in, but related to 2 one-time initiatives that you'll see in the next page of the little budget book that includes scholarship and loan repayment help for nurses. So, you'll see us going through this theme a number of times when we go through other parts of the budget. They're tied in. The last 2 tax initiatives are both, well, at least the last one is familiar, the Downtown and Village Center tax credit. Currently, there's $3 million of credits that are available. We are asking to increase that to $5 million of credits. And we're also expanding what qualifies from the very tight downtowns to areas that might be very close to the downtowns, but not qualify as a downtown center. So we're looking to expand the definition a bit.
Okay.
that pretty much takes us through the sources. Like I said, we have about 51.5 million of tax expenditures. Those are offset by $2 million of sports betting. So the total deduct from the top line revenue is just under $50 million, but it leaves us for total general fund sources with $2,061 million. And I was going to pass the baton to Hardy to take us through some of the uses, starting with the current services changes.
Okay. It's all yours, Hardy.
Okay, thank you, Adam. For the record, Hardy Merrill, Director of Budget and Management Operations with the Department of Finance and Management. So on the uses side of the ledger, we start off with our base, which represents the FY22 as passed, including we add to that a $15 million adjustment for the $15 million of coronavirus relief fund dollars that were included in the DOC FY22 budget. To establish our current services budget, we add that GF back in, and we add the FY22 Pay Act appropriation. That's where we get the starting point of the 1.762 billion. That's the first number in bold. The next section describes all the changes to that number that represent increases in delivering a current services budget. So from the current services base starting point, we add all the changes in things like employee benefits, internal service fund charges, including fee for space and insurance are included here, caseload and utilization, and changes in base expenditures like debt service or property tax assistance. So with all these changes factored in, we end up at the 1.830 billion figure, which represents the cost of delivering what we define as a current services budget, not making any programmatic or policy related changes, but delivering the same kind of service level as in FY22 in FY23. And I'll note in terms of the high level, that's just a little under 4% in terms of the increase in the current services level budget. I'll add for context that what we went out to as part of the budget development process, meeting with every department and agency statewide, our budget instructions instructed the departments to meet a target increase of 3%. That's actually different than the past few years when there's been a level fund budget challenge that had previously been issued. By and large, our departments statewide did come in at that 3% level based on our instructions. However, there were some increases, including the previously unanticipated increases to employee benefits and internal service fund charges that basically we provided GF allotments to those departments. And in addition to the 3% budget targets they made, and the sum total of all that results in our coming out just a little under 4%. I'm looking at about 3.8, 3.9. So I'll take a pause there if there are any questions on the sort of high level assumptions, and then I can walk through the individual lines describing the specific changes.
Okay, committee questions?
Well,
So,
no, just that you asked for 4% and they, I mean, 3%, and they basically came in almost at 4 with the overall. So, you know, that is a 25% difference.
So what I tried to explain and didn't explain adequately, Senator Starr, is that when we issued the original instructions, we gave them some assumptions such as assume employee benefits rates will be flat and assume no more than a 3% increase in internal service fund charges. That was when instructions were issued back in August. And then our budget review process started in September. We started getting news as part of the budget development process with some of the departments that inform internal service fund charges of increases that were unforeseen initially. So certain departments met the 3% target. However, after the fact, we had increases in certain areas that I suppose we could say finance and management held them harmless and gave them additional general fund to make up, for instance, the unforeseen increase in the benefits rates.
It seems like in healthcare, it was like a 10% increase. Is that
And
in that vicinity?
that is
So
correct, yes.
You can see that 10% on the healthcare side would have, unless you want to say, well, we'll fund that and reduce services or benefits to Vermonters, then if you fund that cost, I also, the pay act for this year is up as well, right?
It is.
That
Yeah.
would be in there as well. So that really skews those percentages dramatically, but the healthcare was the one that was a big driver. Or at least that's my understanding.
Well,
that was
you're absolutely correct. So the first line, Madam Chair, shows across the state, there was a 6.8 million increase in general fund need for employee benefits rate change. And again, the specifics on that were in January 2022. This month, there's actually a 7% increase, and there will be another 7% increase in January of 23. When we factor the fiscal year impact of those two increases, it works out to about 10.7% in FY23, and that's the 6.8 million number we see here. I will add, not displayed on this list of current services pressures is retirement, because we actually felt the sting of the retirement rate increase last year when there was an increase from 21.4% to 25.5%. And that's already, that's the actual rate that's happening in FY22. What happened was in the FY22 budget development process, those retirement rate impacts were not built into the base budgets. In terms of the base budgets, there was a one-time appropriation for 14.4 million that we will disperse to departments to meet their needs during the remainder of this fiscal year in something like a pay act process for retirement pressure. But what I'm saying is the large retirement jump we saw last year, which is around the order of a 20% increase from the 21 to 25%, or cents on the dollar, that's part of the underlying base starting point in the 1.762. We did ask departments as part of their 3% target to account for the retirement rate increases this year, and those are baked into essentially the 1.762 starting point. I'll pause if there are any more questions or comments before I move down the line on the additional line item increases.
no, I think not. We can just keep going.
Okay, so the next line is 3.7 million increase in debt service. Not to jump too far ahead, but since this is considering a current services budget, it does not consider one of the items you'll see down in the policy initiative section, which is if we're to go ahead with the governor's proposed plan to pay 20 million of callable bond debt, we'll actually see a decrease from this number of $325,000 in 23, and then a couple $1 million on the order of the following year. So that's debt service. We have in the next line a decrease in property tax assistance needs, primarily driven by the homeowner and renter rebate figures. There's also current use included in that.
Oh, mhm.
The next line is for annualization of fiscal 22 pay act. Pay Act is sometimes a confusing subject, but what this refers to is the Pay Act changes, the Pay Act changes taking place in 22, for which departments will be reimbursed from the Pay Act appropriation on the general fund side. Those changes need to be baked into the base budgets in FY23. And that's the 11 million figure. The next line, which represents the largest in magnitude of the current services changes, are the caseload utilization and all other pressures pertaining to the Agency of Human Services. So to clarify, this doesn't include salary and benefit increases, which are included in the other lines in this section, and it doesn't include internal service charges. And it doesn't include any retirement changes. It includes all other AHS related cost pressures, so primarily related to caseload and utilization. And that's the $23.4 million figure.
Well, we'll sort that out. I'm sure healthcare is a big piece of that. The one thing that I would ask in that agency figure, obviously the workforce problems that the state is confronting are actually being experienced to the same degree by those community-based service systems that provide the services that the state of Vermont used to provide through our institutional settings. And so mental health is an example, but also choices for care in terms of people with disabilities or our seniors. What are you doing for rate increases? Is that included in that and other pressures? Is that 23.4 reflect increases in reimbursement to those parts of the service delivery system that are under contract and predominantly state funded?
So Madam Chair, you'll find that there are quite a few changes in rate increases that are going to be down lower on this sheet under the policy initiatives section. And in this part of the sheet, we're showing the current services changes. So if we're to continue doing things just the way we are in FY22, these are the projected cost increases based on caseload and utilization. I don't believe there are rate increases contemplated within this figure unless they were rate increases that were already, for instance, statutorily required to happen. AHS could speak better to the specifics, but
Well, I see it's down below 7.1 million.
exactly.
small.
I think that's what you were thinking of.
Yeah. Mhm.
Yeah.
Okay. I didn't know.
What I do need to elaborate a bit further on in terms of AHS is the next line on this worksheet, in which we're showing within the current services section of the budget, we're showing a $9.9 million cost pressure within AHS that we are, rather than building into the base budget in our budget construct, we are actually budgeting as a one-time appropriation. The reason we're taking that approach is that we challenged AHS to calculate an estimate of the cost pressures within the Medicaid program that they attribute to the suspension of Medicaid eligibility redeterminations, which are
Is that Senator Sears' dog?
No,
Yours, Hardy?
Oh, your dog, Hardy?
I apologize that it's my dog. That means there's either a delivery or someone else outside. He's generally quite quiet unless someone's outside the
yeah.
house.
Oh.
Marley's a rooster. He's tired out now from barking at everybody during the Judiciary Committee meeting.
I know that I recall that doing this walkthrough last year with one of the committees, my dog started barking as well, and it actually set off a chain reaction of barking in the background around all the squares on the board. So fortunately, that's not the case today. So getting back to the one-time Medicaid redetermination construct, again, we instead of showing a $33 million AHS cost pressure and baking that all into the base budget, which would forevermore then keep increasing each year, we wanted to make an effort to segment this subset of cost pressure that we think is justifiably considered one-time in nature, since it's related to this specific condition of not being able to perform eligibility redeterminations. So I'll pause there if there are any questions or comments on that.
So where do we get our money, Jane, for our contracted agencies?
That's down in the 7.1 in the next box.
Okay,
So if we're concerned about increases to VNA or the choices for care, et cetera, or our mental health system, that's a 7.1. I don't know what that would mean in terms of increases. Is it a 3% for that provider group or
3%.
3%?
Yeah.
Okay.
So-
Okay, that's where it is, Bobby, in that line.
That's
The Medicaid, that one time, you may, if you've been tracking the discussion about the Medicaid caseload, with the federal increase in the match, we call it the FMAP bump. The quid pro quo was the state could not do redeterminations. So we've built up, and we've taken testimony already about a Medicaid caseload of people that ordinarily would have been terminated for various reasons of not being eligible. So once we go back and redetermine and get the caseload cleaned up, in the meantime, we're carrying a caseload that higher than it would be normally. But it's worth doing because of the value of that higher federal match. So with the federal dollars come a requirement. But what this is doing is saying, rather than assuming that higher caseload is the base, recognizing the extent to which it is being inflated as a result of that federal requirement, and funding that that caseload through a one-time, assuming that the federal bump is going to go away and redeterminations will start again. So the commissioner had mentioned taking that approach for this year as a way of recognizing the impact that time-limited federal requirement is having on our caseload and our costs. So I just wanted to state this is why that is being recommended that way. And it was discussed with us as a possible, with the appropriations chair and with joint fiscal as a way of dealing with that situation. So that's why you're seeing it broken out the way it is as a one-time appropriation.
Madam Chair, thank you for explaining that somewhat obtuse maneuver more eloquently than I could. So,
Well, I've dealt with Medicaid for a long time. But it was back when it was a staff of, I don't know, under 20, and you could administer it out of Elmo Sassarosi's bottom drawer. But that's long ago. And now it's a huge, huge program. And and a lot of money. But a lot of Vermonters are benefiting, and certainly all our children. We should be proud of that. So let's keep going.
yeah, I sense
that
that there's interest in moving to the policy section. So I'll try to wrap up the current services section
Okay.
pretty quickly. So I do need to point out a couple significant lines. There's a line for the Department of Labor UI program pressure in excess of federal funding, and we have in the budget $3 million of general fund in order to deliver the current services level of UI program execution. So you'll recall that in BAA there was a substantial ask of $12 million general fund to support the UI program. We're optimistic that those funds may not all be expended in 22 and maybe carry forward to continue working through their issues there. We're also optimistic that the adjudications backlog, that's a big cost driver in 22, we'll start to get the upper hand on that. However, based on projections of federal funding and cost pressures that remain, for instance, a lot of their new IT systems that are the new way of doing business that are not going to go away, and the licensing and maintenance costs related. We're still projecting a need of $3 million general fund for the UI program, and that's significant to note since in the past, the UI program has not been funded with general funds, and it's been all federally funded. So I did want to highlight that for the committee's recognition. The one other line that I think merits a bit of explanation are the $4.755 million increase in internal service fund charges, which is significant, and it's driven in largest part by two factors: fee for space increases nearing 10% on average for departments statewide, and also increases to the insurance related allocations as well. Finance and management would comment that, I think there is a bit of catch up taking place here after our rather austere budgeting processes involving level fund targets. And when we were issuing level fund targets to departments, we really kept our thumb as hard as we could on raising the ISF rates to help departments achieve those targets. I think we're seeing some catch up and some, running some deficits in ISFs. And
I think this is, we knew this was going to happen when you were suppressing those internal service, and so this shouldn't take us by surprise.
so I will wrap up on our current services budget and changes. And again, those are just under 4% based on the current service delivery. And with that, I'll take a pause and turn it over back to the commissioner.
All right.
So getting to the policy changes, and thank you, Hardy, I appreciate the run through. Getting to the policy changes, I don't think we need to go through every one of these, but we do want to highlight a few of them. Some of them I think are self-evident and you'll recognize them, but others I think require some explanation. Beginning with the first one, the BGS engineering. There are three lines. There are three lines in this document where which are all involved with one specific initiative, and that is we're trying to kind of cap and then reduce our public debt presence, our footprint in the public debt markets. We want to reduce our general obligation bonds. And so the BGS engineering folks, I think the chair was probably remembering that this dialogue has happened over the years, removing the staffing at BGS. These are state employees. They report to work like I do every day. They wear a badge, but they have been part of the capital bill. They've been funded by the capital bill because they're working on projects. They're engineers, they're designers, they're planners. And over the years, in fact, this goes back to when the governor was on the institutions committee. Over the years, we've talked about how appropriate it is to be borrowing in the public markets for public employees. And so this year we're just saying, look, this is a I think, a good first step in taking these out of the capital bill and thus reducing the capital.
You know,
bill.
Adam, this was symptomatic of the pressure on the general fund.
Yeah.
There's no question about it, and trying to make a budget balance and how to squeeze out dollars here and there. And that was one of the things that was done, was to exercise that option, because it freed up general fund to deal with other budgetary pressures. So that's where that's what was behind it. It's pure, it was just pure finding more money.
Right. And
And
so this
the
year
same
we have
was-
the opportunity to
Yeah,
reverse that.
and the same was true with the IT.
Right.
Excuse me, I've got to close the door here. You're going to have some noise.
So further down the list, in fact, the very bottom of the base uses policy changes list, you'll see debt service savings due to GO bond repayment. That too is connected to the same initiative of reducing our borrowing and using surplus base and one-time money to retire GO, general obligation bond debt. You'll remember in our budget adjustment that there was a $20 million initiative the governor put forward to retire some callable bonds that are outstanding. So the savings of interest savings, debt service savings of that 20 million retirement is laid out here in $325,000 savings. But that again, I would connect to the BGS engineering initiative, and there too, we're trying to reduce the amount of new borrowing. And then we're also realizing some savings by retiring outstanding debt. And the final line item that I would point to that is also connected is, if you look further down towards the bottom under one-time uses policy changes, you'll notice a new transfer to the capital expenditures cash fund of 6.525 million. That is a new fund that will be created to use as a pay-go account, essentially. So we're seeding it with some revenue that can be used for not only paying for money that is in the capital bill that we'll take out, but also for using for other initiatives that might be more planning or design focused for projects that normally would be in the capital bill. And at this point, we're hoping will be in a pay-go account. So the combination of that, of retiring debt and taking money that normally we'd be borrowing for and putting it in a pay-go account, will reduce our outstanding debt and thus reduce our debt service payments. So we're anticipating the debt service savings this time of 325,000 will grow substantially over the years as we reduce our overall borrowing.
Wait, gee, we're going to have to we won't need an institutions committee anymore.
Well, that could be a savings on your account, that could be legislative savings.
Yeah, right.
Anyway, the thought, and actually the kind of the policy behind this, or the financial analysis behind it, is that as your debt service savings go down over time, and we think it'll be between 10 and 15 years, you'll be able to essentially self-fund the pay-go by savings that you'll achieve on debt service. So that is the initiative, but the kind of innocuous BGS engineering line, kind of hides a larger initiative that I just wanted to bring to the light.
Mhm.
I think the chair will recognize, all you guys have been around a while, you'll recognize the next line too.
I do recognize it. And I do know you want to eliminate the transfer. I suspect the reason you want to do that is to free up those T-fund dollars to be the match for the federal infrastructure money, because that's going to take a match of over 107 to 125 million.
That's correct.
In the past discussions that we've had, it's been acknowledged, certainly we've purified the use of the JTOC transfers used to be in multiple. Right now, there's only one transfer, and that is to, well, it's one, I guess, downtown, but otherwise it's predominantly been to the public safety, to the state police. And so the thought was that if we were to think about it, that really the cost of providing highway safety enforcement was more in the vicinity of 15 million, as opposed to, it was as high as what, 25, Adam, at some
Yeah,
point?
that was actually over 30 at some point.
Over 30. So it's been brought down. The goal in my mind is always to get it back down to 15 to reflect the actual cost of enforcing the traffic laws and highway safety. What's proposed here is to totally eliminate it for the reasons I think probably was why it's being recommended. Okay.
The only footnote I would add there is the AOT has said that in FY23, they're actually good in terms of federal match. In the out years, they are not. So what we're doing in FY23 is using this amount of additional T fund to fund an initiative you'll see further down the list, or actually on the one-time list, it would be DMV, their just Uber technology project to replace the DMV core system that they're guessing will be in the low $20 million range. So we are in this fiscal year transferring that into a fund that will, or putting it aside to pay for their DMV core system upgrade. But in future years, it will go towards federal match. The one additional point actually that is in that $23 million, 20.25 of that is the JTOC transfer we're canceling, but there's also a $3 million DPS appropriation, base appropriation that goes along with an $8 million DPS one-time appropriation for a total of $11 million. And that is kind of finally gritting our teeth and getting serious about building a new regionalized dispatch system. And I'm sure you'll speak to public safety later on this session, but they are really, really struggling. All of the struggle that you hear about and see in our healthcare system is true in the DPS, the dispatch system. They are just having a really hard time.
Senator Starr seems to have a question.
Yes,
Yeah,
sir.
on that dispatch, on the dispatch transition, what is that, Adam?
So they're going to move to a regional system of, I don't know, as many as 6 or 7 regional dispatch areas, as opposed to kind of all centralizing it through DPS.
Yeah, but we did have
we-
regional.
I'm aware of
dispatch.
that.
Which
I
was
mean,
very
it isn't-
painful. It was very painful.
I'm aware of that.
I guess.
Are
I
you
guess it
doing
was
any?
painful.
Okay.
Well, I think
And
Commissioner
now we're gonna
Sherling will
go
be,
back to the old system.
I can't answer that, Senator. What I would say is Commissioner Sherling has looked at this all different ways, and his feeling is that we just have to take the lead. And I think part of this, or a lot of this, is actually setting up the stations and making sure they have the right technology. He thinks this is the way to go, but I'm sure he'll be able to explain it better than I.
Okay. Well, we will obviously be interested in his testimony.
Yeah.
Considering Senator Starr and I remember those very difficult discussions we had about the consolidation.
Oh, it's
Remember
gonna
that
be-
too.
It was gonna be the best thing since sliced bread. And what a disaster that's turned out to be.
What, sliced bread?
No, bringing
Okay.
them all under one umbrella, and boy, we're gonna have all kinds of help and, yeah.
Well, there's still the other issue that's out there and with towns, and that is some towns actually are paying for dispatch and they're doing it through sheriffs or other means, and other towns are getting it for free through the state police. So I don't know if that's going to be wrapped up in some of that. Obviously, those revenues are important in supporting sheriff's offices. but the towns that are paying would like to have the benefit of having the free service through the department. So we'll have to have more discussion with the commissioner when he comes.
Yeah. Further down, actually, the next line is somewhat related in E911. I mean, not a related initiative, but similar to emergency response. This committee, I'm sure, will remember that last year we transferred some money into the E911 fund to replenish or to eliminate a deficit. You know, that has been recurring. I think it's happened 2 years in a row now. And part of it is that their revenue source, the USF fund, has not kept pace with their expenditures. And, you know, there are some changes within the telecommunications sector that are responsible for that.
I think we're also, my understanding from the testimony, we're also responsible by putting on that connectivity charge, which is off the top, which means that there's less money to go. And I understand your proposal would be to take the money that would have gone to 911 and use it for connectivity, but it raises the question about public access, and the budget adjustment that we got from the House had 300,000 to close that gap because they are also funded. That's public access television system. So could you speak to that interrelationship between your 911 moving to general fund, what you want to do with connectivity, and how you're addressing the problem with the public access television shortfall?
So there is, as you're aware, there is a waterfall for the USF fees. Connectivity is at the bottom of the waterfall. And then there's, I forget, TTY and 2 or 3 things in there, including public access. Those wouldn't change. We're merely saying that the component that went to E911, which was by far the largest single component, that would now be directed towards connectivity. So we'd be taking one component of that waterfall out. So if anything, that should leave more available before you get to the bottom, which would be connectivity. So I think that would actually help kind of solve that problem, because right now E911 is kind of sucking the wind out of the USF fee because it's a substantial financial hit. So if you remove,
I thought they were at the bottom of the waterfall, and therefore that's why they were coming in to get money, additional money.
they are at the bottom, but the amounts that ended up there were not sufficient to run their operation. So nothing actually went to connectivity, which is why they tapped on a 0.3 or 0.4% surcharge to the 2% USF fee, because nothing was going to connectivity. So the idea was to try to get something going in connectivity, at the end of the waterfall. So our proposal actually, I think, would be better for the first 2 or 3, and that there'll be, more revenue. And to the extent that the committee decides that they need more revenue, there'll be more revenue available. What we do say, however, is that if the deficit that is currently in the fund, which is projected to be about $650,000 to $700,000 at the end of 22, we would direct what is in the connectivity fund right now to fill that deficit. And then from then on, all of the money that normally went to E911, we would direct to connectivity.
Well,
And,
in the scheme of the ARPA money that we put into broadband and connectivity, that was such a what is it, $500,000 or something?
Yeah, I mean, it was like $1.5 million. It was nothing.
It's a piddling amount relative to.
But in the out years, it might be something significant. The out years when ARPA dries up and the build out happens, it's going to need maintenance. It's going to need to be technology upgrades, and it could fund that. So anyway, that's the proposal, but I think it should help the other waterfall, call it participants, all of which I don't have in my mind, but I think there were 2 or 3 of them there.
Well, I thought there were 3, 911, public access television, and the connectivity.
So to the extent, again, that there's more that you're taking out E911, bumping the public access television wouldn't be any strain on revenue. You could simply redirect a little bit less to connectivity.
Yeah, okay.
So,
All right, let's,
Hardy, you want to take over or doing a little tag team here?
Hardy's muted.
Thanks, Madam Chair. Had the dog start barking again, so hopefully he settles down. So Adam, you just wrapped up on E911.
Oh,
You've
hark,
got-
hark, the dogs do bark. Isn't that a nursery rhyme? Yes. Oh, well, I'm sorry for the digression, but Senator
it's-
Baruth, do you remember that? Hark, hark, the dogs do bark.
No,
No, the beggars are coming to town. Oh, all right. Well, it's a nursery rhyme.
with something of a loose tie into the theme of appropriations. So,
Yeah, I guess so. I guess so. Uh-huh.
So our next policy initiatives are in the AHS portfolio. So the first of these being the provider rate increases of the 3% level, and this $7.1 million represents the state GC match requirement that would be associated with those provider rate increases. So this is where those appear in the budget. Are there comments or questions?
We'll
around
just
what's-
get into greater detail.
Right.
Obviously, as we're taking testimony.
And the next line has for DIVA 5.52 million associated with a Medicaid rate adjustment, as well as another 950,000 associated with extension of Medicaid benefits for postpartum care.
We have a bill that's in Senate Health and Welfare, and that actually donated to do a separate bill, and I'm not even sure it's necessary to instruct DIVA to do a state plan change to exercise that policy, that coverage option expansion, which I believe becomes available to states April 1st. But I'm seeing that you've got the money here to fund the benefits. So obviously it's an area of coverage expansion that the administration is supporting.
Yes.
And I believe it, according to Stephanie, thinks that there's also a benefit relative to, the health insurance premiums that we might be paying. So glad to see that. I don't know, maybe we don't need to have instructive language to, submit a state plan to exercise that expansion option. I believe it's good for 5 years.
And Madam Chair, I did also want to point out in this initiative, the 5.52 million, that is a continuation of, you may remember from budget adjustment, there was some Medicaid rate adjustments. And this is an initiative that you're probably familiar with, your committee has probably heard it before, but they're trying to bring Medicaid rates up for certain key providers, primary
To
care,
Medicare. Uh-huh.
and they're trying to bring them up to Medicare rates. So that accounts for that initiative, that DIVA Medicaid rate adjustment. That's what that is.
Mhm, mhm. Okay.
Thank you, Adam. And that reminds me as well of the question in House Appropriations, which is why wasn't this included in the current services budget? And the reason for that is since the Budget Adjustment Act has not been passed to include that provision.
Okay.
So we're contemplating it as a policy change. The next line is a new VDH initiative associated with substance abuse prevention, in particular targeted to the opioid epidemic, but also to consider substance abuse a bit more broadly, is my understanding. And that's an $8 million initiative. For real policy details discussion, AHS would be better informed to provide you with more detail there. But that is built into our budget construct. The next line has for DMH an expansion of the mobile crisis unit. There was a pilot program in Rutland, and this is expanding that to, I believe it's six other localities. And that accounts for 1.9 million of new policy initiatives. Also included in this line is suicide prevention, which is again a continuation of a BAA policy proposal that's in the BAA, and this represents the FY23 cost. In the DCF line, which totals over $14 million, childcare related supports make up the bulk of this. The $7 million for provider expansion is, as I understand it, involves summer programs and camp programs, and expanding the providers eligible for subsidies, along with a $4.9 million increase to the CCFAT program. There is also 1.8 million associated with the Families First, which is a federal guidelines and to basically establish, compliance with all of the federal standards of the Family First program. DCF's estimate is 1.8 million associated
I
with that
see
initiative.
Senator Sears has his hand up.
A couple of questions. There is not a similar provider rate increase for DCF that you've given to Dale, Eva, and DMH. That troubles me. That we don't have that same latitude. I also don't see any new money for a replacement for Woodside, and that troubles me as well. We are in a crisis situation, and I don't think, I just don't see that reflected, at least in this budget. In terms of
Are you talking
placement,
about
trouble
rate
use.
increases for group homes, Dick, residential programs?
Yeah.
But they're rate setted, so they need help before probably the rates can be adjusted. Is that what you're asking?
Yeah, I mean, there's no increase there that I can see.
That's yeah, I will yield to DCF on that, but I would note
Okay.
that there are some increases for some, call it DCS constituents, notably foster families and respite care.
Yeah, but I'm looking at their substitute care budget and
Yeah.
where the crisis lies. And we are in the midst of, at least here at the Bennington Hospital, in a crisis over the number of kids that are being referred who have serious problems that are in DCF custody. I just don't think there's a recognition of the problem here. DCF clearly has less of a, for kids in custody, has less of a constituency than DMH. I've seen this over the years, and it's very troubling. So DMH has much more lobbying influence to get the 3% increase. So I do want to hear from Sean Brown about what his plan is, but without we have no Woodside replacement. Beckett's a year away, and I don't see any contingency plan here in terms of that.
I will give Commissioner Brown a heads up. I'm sure he'll be prepared to answer.
I'm sure. Thank you, Commissioner. Appreciate it. But it is troubling.
Actually, the next line down deals with long-term care facilities. This was a particular initiative of the departed secretary, Smith, who, really bent the governor's ear and mine over the need for greater oversight of long-term care facilities. The amounts you see there, just under $260,000, that's part of it. That's also will be
Maybe you should say former rather than departed. Makes it sound like he's
Former.
left his earthly existence.
Well, he's living pretty large out there on the islands, I gather.
I'm sure. I bet he's put his feet up and thinking big.
Before he left, though, there's, I don't know how many 300 facilities. His goal, and the goal of AHS actually, is to have at least one visit a year to each facility. And right now they're just not staffed to do that. So that they're going to staff up. I think that's for 6 overseers and I think 1 administrator to cover. And again, that will have some federal money behind it too. So that's not the total cost, but that's the general fund cost. And then following that is a familiar one, moving the community high school back into the ed fund. There would be no governor's budget without that, kind of like military retirement pension, tax exemption. This is same, we've done this for years, and it is a belief that it should be in the ed fund.
You don't need to tell us.
I won't. I promise.
No.
I know you guys have been receptive to that.
Although we finally did get recognition that paying the retirement of the healthcare costs for current teachers for when they retire was a education fund expenditure. So we'll just keep working on that. But it does have it does have a familiarity to it, Commissioner. So it's right up there with sports betting and Keno.
Keno and iLottery are in the ed fund. I mean, that obviously, that doesn't show up here, but that is an initiative. You'll see it in the language. So we're giving that another go also. And yeah, I mean, but it is something that we, Liquor and Lottery will tell you, it's something that we should be doing. It's, many states do it, and it's not just a revenue thing, but you'll see that in the language. It doesn't show up in the general.
What about break open tickets?
Well, our departed legislator, Jim Condon, would be very happy to take that up. So.
Oh, my goodness. Oh, all right. As the old saying, the durability of a cockroach here.
There should be something like the Island of Misfit Toys for all these kind of initiatives that can never get off the ground.
So
don't you just love coming before this committee? I mean, just think of all the, synapses that are snapping here on a Friday afternoon.
Indeed.
Okay.
I'll add
Especially
that,
for those of us, I haven't had any lunch because I had a meeting at 12:30. And so it has been quite a day already. But we'll keep going and hopefully have a little break between this and 4 o'clock when we have our next meeting. So we'll keep going.
would you like me to jump in, Adam?
Yeah, thanks.
Okay. So the next line involves a $3 million base increase for VDOL associated with UI modernization, which is also an initiative on the one-time list on the next page of this document as a $30 million one-time, which would be an appropriation of general fund to fully implement that project over the next few years. And VDOL and ADS are assuming a $3 million cost as an additional base cost as well to be borne by the general fund associated with that initiative. There is also proposed $1 million base increase related to expanding an existing VDOL internship program that's proposed in the governor's budget. Should I pause there for a moment or keep going?
No, I don't see anybody
Okay,
at this point. I'll probably save our thoughts or questions for, when we get the testimony from the individual agencies or departments.
understood.
And, I can pick up for UVM and state colleges and VSAC. There's a $10 million increase for UVM, and 9 million of which we're directing to the English department at UVM for Senator Baruth. But I mean, the story there really is that they haven't had a base increase. You guys probably know this since, I think, 14 years. It's been a long, long time.
Mhm.
And, like every other institution, they have costs. And so we thought now was a good year to do that. There's also a $5 million increase that continues along the base increases that we've, committed to for Vermont State Colleges. That will be a total of 10 from the time we started. So they're moving up towards their kind of the mid New England average level that they're gunning for. And then there's a $1 million increase for VSAC, which is specifically for their advancement grants program. That is their non-degree program that we just think is terrific. I mean, it kind of fits right into the need for more folks in the trades. But so this is a program that for people who are looking for certificates or anything.
Yeah, we've seen that. They fund CDL programs for adults, for example,
Exactly.
and
Yeah.
help fund. Senator Starr seems to be very anxious to ask his question. Senator Starr, you're
You're
muted.
muted, Bobby.
I was just wondering on the, on that money for UVM, is that going in their base budget that we appropriate each year?
Mhm.
Yes, it is.
What is their current base? 40,
42.
42?
So that's a 25% shot. That's pretty good.
Well, they
Well,
waited 15 years to get it.
Well,
And-
yeah,
And I would
but
I
we
would
haven't
just-
been able, we haven't had any money to give them an increase with. But this will, like a quarter of their money, 20% goes to the extension service, which is part of UVM, which has really been suffering, because we haven't been able to put a lot more in, and
Yeah.
this is going to really make a real positive difference, I think.
Well, it goes to the extension service, I guess, the medical college, and then scholarships, right? I
Mhm.
think it's
Yeah.
a three-way. Senator Baruth, did you have your hand up?
Oh, yeah. I
Or
was
your
just gonna-
hand out, or did?
I was just going to say that in addition to waiting the 15 years or better part of 15 years for the raise, they, over the last couple of years, they've, I think, been uncharacteristically quiet as the state colleges got big infusions of money. And I
Yeah.
put that to their credit that they waited in that sort of existential moment for the state colleges, and they've come forward this time. So I think it's it's to their credit that they were not demanding dollar for dollar over the last couple of years.
Okay, we'll keep going. Obviously, the cost of higher ed has been a topic of concern, and how we rank. I do know that the state colleges, their student composition and the sort of the wealth that they have to draw on is much more limited than UVM, but 15 years is a long time. And the other part as well is that they've held the tuition constant for
Mhm.
a number of years as well. So it shows a great effort to try to be sensitive to the cost of education for Vermonters. And we do have a couple of UVM grads, or at least one. Senator Sears is
All right.
one. Yeah. Actually, Bobby, you were state college system
Yeah, I was
and
supposed to go.
Rich. And Rich.
I had a green and gold scholarship to UVM and I passed it up.
They didn't even have it back then.
Oh, yes, they did.
Were you the valedictorian, Bobby?
Bobby,
He was the only
Bobby, you were
graduate.
valedictorian?
No, back then they gave it to the highest ranking boy and highest ranking girl. And I was the highest ranking boy in my class, which I wrote the salutatorian's address to give, but I wasn't the valedictorian or the salutatorian, but I did write the address that the salutatorian gave.
How many boys were there in the class, Bob?
Oh, two.
Yeah, so maybe only a half. So we were about 10 and 10, I think, or 11.
Mm.
Yeah.
Oh,
Good.
Back when Bobby went to school, tuition was $100 a year. So
My folks were mad at me for not doing that.
mm. Oh, well, I guess then we probably should keep going now that we've talked about everybody's higher education experiences.
So we're offering the Senate a menu of options at A&R, including a part of their much larger climate package that they can come in and speak to you about. There's also a $200,000 appropriation to maintain connectivity in the park, and then a appropriation to help people navigate through the permitting process through additional software. And there's also $150K for wetlands mapping and a couple of positions. So that's kind of a menu of options, but I'm sure they'll be happy to come in and explain them to you.
All right.
The ACCD, the new and remote worker grants. So you'll notice there's a larger one-time initiative there, I believe $6 million. This, though, is factoring it into the base. This is kind of making the initiative part of the base. This is something the governor and his team are very, really believe is very important in terms of kind of readdressing or addressing our issue with workforce. And it's one way of building the workforce, not only training Vermonters, but also attracting new people here, or frankly, keeping people who are coming here for school.
Actually, Mother Nature may be helping more than anything. It sounds like, frankly, with the COVID, Vermont's people are coming because it's safe, but also as we're looking at climate change, we have identified counties in this state that are being recommended for people to move to because parts of the country are getting flooded out, they're getting dried up, they're getting burned up. So it may very well be sort of like when we had that first slug of money, all the publicity we got for it actually was worth more than any of the money provided. So one never knows.
Wow.
I realize the demographics are interesting, but I think in the last 18 months, perhaps things have changed, and to what extent they're going to continue to change, and the attractiveness of rural areas. There's a lot of study suggesting that we're going to see people, the way in which people have moved, it's going to perhaps alter some of what we're seeing, which then gets us into housing. Because
The numbers.
And what's happening is the more pressure, then the people with the lowest incomes are going to get squeezed right out even more. So that's part of what the housing initiative is about. So we'll see.
Well, one of the things we're responding to here, I mean, the numbers in our workforce, and you're right, it may well have turned around, but the numbers are really worrying.
Bad.
We lost 24,000 workers during COVID, and that's not the beginning of a trend, the continuation, acceleration of a trend. I think the governor is just very worried about it.
in some ways, bigger population puts more pressure. I mean, are we using our traditional metrics around our economy and et cetera? It's a very interesting thing as we're related worldwide. And I'm not getting into that discussion, but there have been many people that say actually having a reduction in a population and the stress that it puts on our planet is not a bad thing, but all our economic metrics are based around growth. And maybe Mother Earth is only so much growth, and expansion is good. But that's a longer term discussion, and it gets into how we evaluate other aspects of quality of life. And they are those social amenities that are really, can be considered in economic models, but probably aren't always. So, all right, we'll keep, now that we've gone into world peace and climate, we'll go back to the
Yeah.
budget list here.
And so just to keep Senator Starr interested, we put a little extra money for working
Pocket
lands.
change.
The mystery
Yeah,
of $406,000 is merely that there's currently $594,000 in the working lands base amount. And so this would bring it up to $1 million even. So we're increasing the base. You'll see there's a number of other ag initiatives further down the budget in one time, but this is really their kind of headline program. And so there's another.
Senator Starr has got his own ideas about some ag initiatives, so.
Yeah, I
We
got a
have to-
couple.
Yeah.
All
he's
right,
got a
we
couple.
may listen to them.
Yeah.
With both ears, I hope.
There's also a scientist for PFAS testing. And there's actually a one-time initiative to purchase the equipment that the scientists will work with. But we thought purchasing the equipment without putting a scientist in the budget wouldn't be very sporting. That's also, there's some, I believe, federal money.
That's the way we usually operate, Adam.
Well, you could contract it out.
Well, we
Oh,
could do
that-
that too. But-
Those are
Yeah.
both very good initiatives.
All
So
right.
that kind of takes us through the base initiatives. What I would point out here is there's the line below that you see just under 105 million of one-time initiatives in section B1100 that is in the language. We also, for your reading convenience, on the next page of this document, you see where each of those, or what each of those initiatives are. It probably would take us some time to go through them, but I would encourage you to look through them, and I'm sure the agencies and departments of jurisdiction will be very happy to come in and explain them.
I'm sure they will.
The total is a little under 105. In addition, I spoke earlier about the capital expenditures cash fund that will kind of get us down the road of PAYGO. The treasurer also, along with the administration, would be very happy to talk to you about that. And then I guess a couple of final things on this sheet. One is that we are likely to end FY22 with deficits in the workers' comp fund that really, I think, gets to, frankly, unfortunate experience with estimates versus actual experience. So we're facing a deficit that we would like to fill before the year ends. And then, Hardy, I think the all other insurance fund, that was basically a premium increase that came kind of after the fact. Is that correct?
Sorry, my cat never has anything to do with me unless I'm in front of this screen. I'm sorry. She's kind of a big girl. Oh,
Fortunately, my dog didn't see her, so we're okay.
she
in-
weighs in at 22 pounds, so she's a They're
That's a
probably as big
small
as many
dog.
dogs. So I'm sorry for that interruption. Yes, Hardy, what were you
Adam
saying?
was, sure, Adam was speaking about the, basically the offsets to fund deficits in work comp, in which we were proposing $6 million to offset that projected deficit at the end of the year, and also $1 million
Did we have some
for,
big claims? Was there something that happened? I know that, we had that decision a number of years ago about contracting out because workers' comp is so complicated, the rules change and so forth. So I know that we were able to clean up some cases and stuff, but did we have something atypical that happened, or did we just not fund it at the level we should have for a few years? How did we get here? Is, I guess, my question to you.
I think a high level explanation would be that after, the process several years ago that you refer to, in which we began contracting, and, one of the conclusions was that we were really reserving more than necessary in work comp. I think to some extent, the pendulum swung a bit farther the other direction. And then combined with that, we've seen, we've reserved the amounts projected, and due to a combination, you can't point your finger at something like runaway claims or claims of a specific type, but it's a combination of both claims experience and also healthcare cost increases that have driven the actual costs versus the actuarial assumed costs, and that's where we end up with a deficit.
Okay.
Is
Right.
is that workers' comp stuff in regards to state employees?
Yes.
Mhm.
Yes. So what this refers to, Senator Starr, is we are our own insurance company. So we contract with actuaries to tell us how much we should reserve each year, and we put it away, and then we pay claims out of that bucket, and we contract the management of the claims, but we are self-insured for all intents and purposes. We're the carrier. So this is, yes, we're ending up, if we were a private insurer, we would be raising the rates to our client in order to recoup these funds. We are needing to collect more money from ourselves in order to offset this deficit.
Yeah, the actuaries, they were accurate in what they were telling us to save.
Well,
Did you?
the actuaries make projections based on assumptions.
Yeah, I know, they're wonderful folks. Yeah, they're off as much as they're right, and never have any responsibility to face for screwing up. I really like those folks.
I can tell.
Well, we all do our own analyses when it comes time. Do I do a filling or do I do a crown? Do I do this or that? Because how much longer am I going to live to recover my investment? So I guess
the silver lining, Senator Starr, is since we are the insurance company, we're paying the money we now have to pay to ourselves, and it wasn't paid to a third party who was actually making a profit margin on it. So the silver lining is we should have charged ourselves more. So now we need to catch up, but we're at least paying it to ourselves. So
that's a good side.
Yeah, I guess that, thank you, Hardy. That was a good spin of
really
what we're doing. 6 million, Bobby. We owe it to ourselves, and we're we
paying.
have to fill the fund. So, okay. Other questions or whatever? It's hard. I keep looking over at my other screen here.
The only other comment I make is you'll notice a fairly beefy contribution to the stabilization reserve, which is outsized compared to past years. And that has everything to do with the fact that the general fund in FY22 is anticipating to grow, has grown, and along with budget adjustment will grow more. So that will keep it at 5%, which will bring the stabilization reserve to about $107 million. When you add that to the human services caseload reserve at 97, and the balance reserve, the rainy day fund at 80, add 3 million in for the 2753 reserve, which would just be this year's contribution since we're going to pay it out. And then 150 million for the pension reserve. And, our total reserves are well over $400 million.
Yeah.
Well,
great.
we're gonna unreserve the pensions because.
So I've heard.
Mhm.
But still, I mean, if you think about it, our reserve levels, when you just take the balance reserve at 80, and that for years was at 5 million, then it got up to 30 million. It was 30 million for a couple of years. Now it's 80 million. The stabilization reserve at over 100 million. I mean, that's impressive. Caseload is at 97 million. So we've got, that's pretty beefy. I don't think we have anything to be ashamed of.
I don't think we're ashamed, and I guess that one of the things that you hear all the time, and I do think that the appropriations committees in both the House and the Senate have been very vigilant to build reserves and to try to address areas where we have underfunded and get our fiscal house in order. And in this environment, this is the opportunity to do it, because we're not, anybody who's going to be here out 10 years from now, they'll never, I don't think we're going to see this infusion of money and the resulting revenues that were being experienced. This is a time to really get our fiscal house in order. And so I think building the reserves has been a priority, and getting the rainy day fund there, and setting up that 27th payroll and 53rd week are all examples of doing a better job of anticipating costs and funding. So, we can take a great deal of pride in terms of what we have for revenues, the reserves, because it's been a very conscious effort over the last few years to do that. So, and if we can, and the pension bill is going to come out of the Senate, and it is going to use some of the reserves. There's no question about it, but they were put there very specifically to help us negotiate and come up with some kind of an agreement. So, and I know that that's not reflected in the governor's proposed, and it's something that we'll have to accommodate as we're building the budget, but you certainly are well aware of that. So
we are, and we built this budget before we were aware of what the House was doing, and this doesn't represent our rejection of that proposal, but we simply had the budget put together before.
no, we understand that. And Senator Sears, I see your hand.
Well, I just wanted to question, maybe in the overall scheme of things, there is a growth in the base budgets. And looking at that, if I include the tax credits and tax cuts, the growth in the overall budget, will it be sustainable in future budget growth as we look at, down the road for when there isn't this influx of federal money, and what pressure are we adding to our colleagues who may be here in 5-10 years?
So one of the ways this budget addresses that very question, which I think is spot on, is you'll notice that there's $105 million of one-time initiatives, but there's only $77 million of one-time money. So we're actually using base money to pay for a number of one-time initiatives, which will have a natural braking effect on our spending going forward, as these one-time initiatives are not repeated. Yeah. That's one way of dealing with it. The second way, frankly, is when we sent out our budget instructions and said to agencies and departments that, this year we're going to be asking for a no more than 3% base increase. Departments may have been initially pleased in the sense that for the past 4 years prior, we'd asked for no increase. Well, now we gave 3%, but as Hardy mentioned earlier, that was also asking them to swallow substantial increases, for example, in retirement payments. So 3% really was not a gift. It was, I think, an acknowledgement that we had costs that we had swallowed. And, as Hardy said, we put our thumb very heavily down on base pressures. But, at the end of the day, you've got a collective bargaining agreement that increases wages. Many of the services you offer are more expensive. The programs are subject to inflation that we offer. So, but by setting an initial goal of 3%, I think we kind of answered the idea that we have to be mindful that out-year revenue forecasts are pretty sobering.
There are a couple.
I'm
There
sorry,
are-
Dick, I couldn't hear you.
Marley's barking.
Oh, oh,
There are a couple of areas that we probably need to shift from fines and surcharges and other areas, particularly victims' rights, the Center for Crime Victim Services and some others. And I don't think they can survive on that, and they need to be in the base. So it's not, in the overall scheme of things, it's not a lot of money, but for them, it's survival, quite frankly.
Yeah, you'll notice in the budget adjustment, I believe the House put in money to fill their.
Yeah, but I think it's going to be, I think it would be, given the times we're in right now, it'd be a good idea to start filling those in with.
it's really no different than the 911 problem. It's an ongoing commitment in service, and the current way of funding it is we've postponed. Well, they were talking about since 2013. So there may be a number of areas where, when we're talking about getting our fiscal house in order and recognizing those costs, and and that it's not just a one-time shoring up. It really needs to be done in a way that provides long-term response. So that's only one, and there are probably a couple of others as well that will be part of our deliberations as we're moving forward. Other comments, and the one thing I think is important to state, though, and that is the unwinding and what the world looks like 18 months out is really where the economists are saying it's really spongy, and the base is only going to grow about 1.7%. Is that right,
Yeah.
Adam?
And then 2% over the next year. So yeah.
So it is very modest growth, so that having not growing that base right in this current environment is really going to give greater capacity to address what that fiscal reality looks like. And I'll tell you, the tax committees are going to be looking at, these tax expenditures and what that number should look like. So it's a very valid concern, Senator Sears. And I think, it's really important to keep that in mind, that we're making decisions today, but we've got to be always conscious about what are those implications for 24 months out, and particularly in such an uncertain fiscal environment. So on that note, it's almost 3:00. And so I'm thinking that perhaps people would like to call it a day. It's Friday afternoon. Senator Sears has a long commute to Bennington.
Bennington, and there's usually heavy traffic coming north, so.
Yeah, to the ski area. So unless there are further questions of Adam and Hardy, I'm going to suggest we end today's committee and adjourn until Tuesday, and hope everyone has a good weekend.
And
So
Madam
thank
Chair,
you.
just
And
wanted to-
we'll